are back here at the Fraum Center. Dr. H has joined us. We always look forward to chatting with you.
Thank
and
you.
Today we're going to talk a little bit about symptom relief.
Yes.
I'm sure people come in all the time
Mhm.
and want relief from what they're experiencing
Yes.
that is not comfortable.
Yes.
Tell me about some of the opportunities that are a little bit different when they come into this practice
Yes.
than traditional medicine, if you will.
Well, a lot of the things we offer for symptom management are based in physical interaction. Okay. So rather than giving somebody a pill to swallow necessarily, right?
Okay. Yeah.
We've got a non-surgical spine decompression machine for backs.
Oh.
Yeah. And so, what we can do for people with bulging discs is amazing. If we take some pressure off the spine, turns out it will fix itself far better than, other options.
Makes sense to me.
Right, exactly. We have a medical grade laser that increases the blood flow, helps stimulate nerves. It is fantastic for acutely injured muscles. Yeah, it's also very good for neuropathy as well.
And these are non-invasive procedures.
Correct. These are all external. So high grade cold, we have a cryo gun that we find very effective. I've got
Now, what would that be used for?
Again,
inflammation,
anything that's painful, whether that's a joint or a muscle.
Okay.
An acute injury or even a chronic injury. Tell you what, people with rheumatoid arthritis, their poor hands are so inflamed.
Mm-hmm.
I have a friend who came in, we did that cryo on his hands, and for the first time in 15 years, he was able to get his wedding ring off. It had been swollen on his hand that long. So, these ways of physically interacting with the body to encourage scar tissue to start moving, muscles to relax, whether that's a physical therapy referral, neuromuscular re-education with Dr. McGinnis. He's a big, we're big into that.
What does that mean, neuromuscular re-education?
Well, all of us, given over time across our lifetimes, whether we're born with an odd scoliosis, right? And that will really affect muscles over time because you have a section of muscles that are shorter than the other side. So you've got all this asymmetry. And, you do 60 years of that, and those muscles are going to have some issues.
It's really interesting that you're saying that. I'm thinking about myself when I stand now, I lock out my knees and I find that pushes me. And I just noticed that the other day. I'm like, I wonder if that's kind of what you're talking about.
Yeah, absolutely.
Or sitting hunched over the...
Yes, absolutely. And
look at me now. I'm like, oh.
And then too, along with neuromuscular re-education, sometimes we need to use electricity, so to speak, or electromagnetic forces to help trigger that. Because sometimes if a muscle has gone for so long without being triggered the right way, it may not trigger until we start activating it externally.
We need a reboot on our muscles sometimes.
We absolutely do. And I've been working on a reboot on some of my muscles. It turns out I don't use my left side as well as my right.
Isn't that so interesting?
No idea why, but it's a problem on my left side. So I'm working on it.
So you practice what you preach in a lot of things.
Yes.
It's got to be absolutely fascinating. Is discomfort what most people come in for? Is that really what brings people, look, I don't feel good, something that's achy or tweaking or just feeling crunchy or whatever?
No, it's not the discomfort that brings them in. It's the thing that they can't do that they value.
Oh, okay.
Pickleball, golf.
Picking up my kids, grandkids.
Picking up your kids, grandkids, ability to travel. Artists, when they start having issues with their hands.
Makes sense.
It's not usually the pain or the discomfort. It's something in their life that they're no longer able to do that they value.
So what I kind of hear you say is you're not just treating me symptomatically, though. You're trying to kind of reorient me or get me on a path of, health, a path that I can improve on.
Yeah. I mean, because if the goal is solely pain relief, right?
Yep.
I got lots of medication I can throw at you for that. Some that I agree with, some that I don't. But so if the goal is only pain relief, that is an extremely short-term, narrow-sighted, short-sighted.
It's not helping me, it's just masking it.
Right. Okay. And I mean, at some point, you do need to work on the pain because people have to sleep.
Yes.
And they need, and
That's
chronic
fair.
pain will make people depressed and things like that. But we've got to look past that too. It's not just about the pain. It's that your muscles haven't worked right in 10 years because
Right.
of this issue. And now your gait's off and, you've got all these other problems stemming
Which
from
is
that.
exacerbating your
Yes.
discomfort. Oh,
Yeah.
I'm getting it. I'm starting to get it. Oh my gosh, it's always great to talk with you. Stay with us, more to come.